about what is it, right? And it's sometimes an interesting perspective because you hear about it in medicine, you hear about it in dentistry, you hear about it on the news. And if we really think about the definition, it's very simple. It's a computer system that can solve problems that humans teach it to solve, right? So we think about teaching, Siri. If I ask Siri right now a question, she might actually answer because she's right here. It's very easy to teach those responses, right? And when we move through AI, we think a lot about the scary side of AI, right? What's happening with AI? Where is it going? The robots are taking over the world. And really, we're focusing on a more narrow-minded type of AI. So we're not super worried about this generative AI that's going to come and take over. Now, AI is kind of snuck into our world without us even knowing it. So we think about AI today, we see a form of AI, which is computer vision, right? And that's in your self-driving cars as well as facial recognition. Again, those of you that have that active on your phones, or even when you're walking through an airport. And really what we're going to talk about today is the computer vision side that we use here at Pearl, which is the dental radiology. Natural language processing, those of you that have used ChatGPT, digital advertising, coming soon, some sort of adjunctive help to us charting, right? Imagine walking into an operatory and being able to say, Bob has a toothache, it's been hurting for 3 days, tooth sleuth negative, whatever the case may be, you're going to be able to have that just annotated for you so you can spend more time with your patients. And then also predictive analytics. We are, again, experiencing these on a daily basis. We're putting information into our cars to figure out where are we going. Even though I know how to get to a restaurant, I'm going to put the navigation on because maybe there's a better way. So we've really already embraced AI in our world. And if we think about how can AI really focus on giving us some time back, and we're going to walk through that today. So when we look at AI in healthcare, there's a lot of different ways that we're seeing AI. We see it in diagnostics, drug discovery, different types of treatments, and even robots. And as we move into the business side of AI, there's a lot going into really just kind of being able to analyze a lot of data, make better decisions. We've seen customer service calling people back for your practices, and even personalized advertising. I would personally love to have a little Tesla robot running around and helping me, make dinner or do laundry or something. But tonight we're going to talk about AI in dentistry and how is this really changing the way we're practicing. There's a lot going on in dentistry. We talk about, automated perio charting, enhanced scheduling, insurance verification, staffing and workflow. So there's a lot of ways that our teams have already enhanced their day by using AI to streamline those simple tasks. So how did Pearl really train a robot, not a robot, a computer vision system to read radiographs? We took a lot of data, we did a lot of training, and now we have an output. So that's a very simplified way of explaining what Pearl's been doing and how AI works. But in reality, when we look back at the history of modern dentistry, we think about how far we've come. So training those models has been happening since the 50s, but just recently we have models that are more performant, more scalable, more affordable. That's why we are able to now introduce AI into dentistry. We remember those days where we used to take regular radiographs, right? Dipping them into the fixer developer, hoping nobody opens the door so that you don't have, the entire FMX exposed. Not that that's ever happened to me. It has. And then we've moved into the air drill. I mean, I can't imagine not using a regular drill, but I remember the first time I practiced as an assistant and they had the polisher on those ropes. And we've come very far to digital scanners and aligners, and now we see AI in dentistry that's really becoming a basic essential utility to our daily workflow. So we walk in, we turn on the air, the water, And all of a sudden now we're going to be thinking, did we turn on the AI? As we move through adopting AI into our workplace, it's going to become something that we thought in the past, wow, remember looking at black and white images for all of those years, right? So when we think about dental AI, what does that really look like? What does it look like in my workflow? And what does this look like for my patients, right? So we're talking about basic real-time patient-facing pathology detection that's going to occur the minute you've taken your radiographs, highlighting areas of decay, calculus, bone level measurements, notable margins, and you see these patient-friendly colors, allowing teams to really be able to have a better engagement with their patients so that they can understand, like I was saying earlier, the dentistry that the clinicians are recommending. When we look back at some of our studies, we've seen that when we see the dentist looking at radiographs, humans are not perfect. When we look at Pearl alone looking at radiographs, the AI is not perfect. But our FDA's trials will actually show that when we have Pearl plus the clinician, we're able to detect 37% more disease earlier, as the computer sees shades of gray much earlier than the human eye. So how we're focusing on using this in our dental world now is regular X-ray sensors, regular imaging systems, and within seconds you can open up second opinion and you're going to see that analysis ready. So you can review the images and you can share them in your hygiene exams or in your new patient appointments, as well as on those patients that are coming in from the restorative side. We do know that we still have some clinical inconsistency in dentistry. There's a lot of studies out there. All three of these will be on our website, but the one in the middle is the one I want you to think about. We took almost 8,700 images and we gave them to 3 different dentists. And we said, we'd like you to circle an area of decay that you see on the radiograph. Not would you fill this or anything else. It was just, do you see pathology present? And what we found was they agreed with each other about 4.3% of the time. But what I found was most interesting in this study was that these clinicians came back 90 days later, they reviewed the same images, and they agreed with themselves 70% of the time. So the moral of the story here is we're not perfect. AI is not perfect, but like I was saying earlier, we can see that we're better together. And the clinical inconsistency is really what's fueling that lack of trust that we still have in our dental space. I'm sure most of you have had an experience where you've actually had a patient come in asking for a second opinion. I used to have, when I was a hygienist, my friends would come in with these big long lists of scaling and root planing and irrigation and arrestin and lasers, and I would go in and probe, and it would be maybe a 4 millimeter in a couple spots because they were a little overdue. So I do think that there are extreme inconsistencies in dentistry, giving rise to that continuous unfortunate mistrust in the dental space. I think all of us would agree on this call that the quality of dental care begins with that initial accurate AI analysis on your x-rays. And I added AI because that's what we're going to be moving into. We're all reviewing radiographs on a daily basis, but now we're going to be moving into a place where let's look at that second opinion, right? The doctor is the first and final decision maker, but it's always nice to have a second opinion. When we're typing out an email and we see that little red, spell check, it reminds us that, let me take a closer look. No, I spelled that right. That's just a different word. Or my name has 2 E's. There's always a line under it saying IE. But I'm thankful a lot of times because it's the EIE situation that it's correcting for me. That is kind of how second opinion works. Doctors are still focusing on x-rays. They take a second opinion perspective very quickly, and they go back and make their diagnosis. So one of these statistics was really kind of surprising. 64% of patients say they don't understand the x-rays during a consultation with the dentist. Now, I always thought there's a lot of patients that didn't understand it, and I continuously explained areas of incipient lesions or areas that have been more progressed, as well as, I used to hold a pencil up to the screen when I was talking about scaling and root planing and telling them where the bone level was and trying to zoom into those calculus pieces. I'm sure if we took a poll, this story is probably resonating with a lot of hygienists as well. But what we have found is all of these times that we've been doing this, patients do not understand what we're telling them. And there was a study done by Ora Pharma that talked about the number one reason patients don't accept the dentistry isn't because of money or fear, which is, I think, what we always believe, but it's because they didn't understand it. And I think that we've all done a really good job, but can we do a better job? So let's walk through a radiograph review. I'd love for you guys to play along. Kimberly, maybe if you're here to call out some of these answers in the chat, we are going to think about how quickly we can review radiographs, as well as what it's like to review radiographs from home versus what it's like to review radiographs when doctors have, a patient in room 3, they just anesthetize, they have an exam in room 4, they got to pay some bills, answer the phone, send an email, and it's really quite powerful what dentists can do when they're moving through their day and all the decisions they have to make. But maybe we can make it a little bit easier on you. So let's take a quick poll here. Those of you that are still around, hopefully, inside of the chat, we'd love to know on the radiograph, how many areas of decay do you see? All right. I'm waiting in the chat. I'd like to see people playing along. And remember, all you doctors out there, you've got patients.
4, 0, 2, 3, 5, 0, 4, 1, 3, 0, 0,
Amazing.
1, 4, 3. Big range here. 1, 4, 3.
That's really very telling of the statistics we just reviewed earlier. And remember, it's not what I fill this tooth. Really what we're talking about is, do you see pathology on the radiograph?
I have to give a shout out to Kelly, who said 6 with subgingival calculus.
We have an overachiever there. So we're showing 4 areas of potential decay. And notice as we hover over that segmented lesion, you are also seeing additional data points. You can see 28 and 29, very small. Now, remember the question was, do you see decay? Not, are you going to fill it, right? Because that's the decision the doctor's going to make. And I think it's important to think about how fast you reviewed those, but this is appearing instantly. And maybe all you do is simply shut it off, take a look, turn it back on, and you reviewed your radiographs much faster. Okay, what about this 14-year-old child? No history of decay, no concerns. Anybody see any cavities here?
A lot of votes for 2.
Okay, good. Excellent.
Oh, one for 3. Yeah,
Good.
between 2 and 3.
Perfect. Okay. So we can see these, but what about mom or dad or the caretaker, right? This child's 14 years old, they've never had a cavity, and now they have a cavity in the front teeth, and you get to tell them that they are going to possibly need to fill these areas. Now, 14 is very young, maybe you're not going to fill them. But when we're explaining it to a patient, or in this case, a patient's parent, this tooth part segmentation tool is really where we take the diagnostics to the operatory and really talk about that case presentation, right? What we think about here is we already are thinking about that tooth surface filling. Are we going to do it in 5 years? You might have to have it replaced if you whiten your teeth. We're going on and on and on because that's what clinicians are doing. But the patient or the patient's mom or dad is thinking, what? There's a cavity. We've been flawless in the front teeth. So we're really able to use these patient-friendly colored images to paint the picture, decrease the amount of time we're having to explain the areas of concern to a patient. And now we freed up time to answer questions for the patient. So we talk about average case acceptance in the United States is less than 50%, right? And we know how many cavities there are. It would be really ideal if we could increase our case acceptance on the dentistry you are recommending. It is not Pearl's job to tell you what to fill, and it's also not Pearl's job to recommend additional areas of decay unless we need to point them out. But the whole point is the fact that you have another set of eyes with this extra data and the ability to turn this around and show it to a patient in these color-coded images brings your case acceptance to that next level. Somebody was cheating earlier and figuring out where all the calculus was, but let's do one last quiz here, right? Okay, calculus. So when we, as we're going through this image, as hygienists, right? A lot of times, or dentists, you're talking about an asymptomatic foreign word that people may have never heard. They're here for a basic cleaning. They've been going to their dentist for the last 20 years. Maybe they're a new patient, or maybe it's an existing patient that was gone for a while, or you're seeing some areas move into those larger measurements that we're not fond of seeing. When we're having to discuss, hopefully you got 6, periodontal concerns, you're now giving the hygienist the tools that they need so that the patients can understand what they're recommending, right? So it really kind of becomes, again, unfortunately, if you take an x-ray and you see calculus after you've done the scaling and root planing, like I have, that's a big bummer. But isn't that the whole point, is to raise the clinical excellence in our own daily workflow, and then to make sure that the patients understand what we're recommending. So I want to walk you through my best friend's daughter. And she came to my old practice I used to manage. And she said, "Hey, you guys recommended a bunch of fillings on Kindle." And she just moved from her pediatric dentist. She was in college for a couple years. She came back and she's never had a cavity. And so, do you have a new dentist there that's recommending more treatment? Or why do you think she has, they told her she has like 5 cavities. So I pulled up second opinion and I said, yeah, you have a lot. Have you ever told her to floss? No, I didn't tell her that. I'm just kidding. She is my best friend. But very alarming. Now think about how many patients that you look at x-rays and you're making that definitive decision. Am I going to fill it? Am I going to wait? What's the caries ratio in this patient, right? Is this high caries patient? I love that the ADA is really focusing on minimally invasive dentistry, but we also need to think about what are our patients hearing from us, right? And you have this nice image showing you that the light pink lesion is in the enamel and the darker pink has progressed past or into that DEJ. Again, painting that very basic picture, how are we going to make sure this patient doesn't have this happen again in the next 2 years? And this doctor decided they were only going to do one of the fillings at that time. So they did 31 distal. Now, we talked earlier about predictive analytics. Imagine a day where you could look at these images and AI could analyze the last one and this one, and it could predict when that disease progression was going to move past the enamel. Would really allow us to make better and more informed decisions today. So lots of pathologies we talk about here, caries. The 2 different colors have really been very informative for teams to evaluate those watch lesions each time. Also plant the seed with the patient, right? Kimberly, these are the areas we're going to watch today. They're in the light pink region. We want to make sure you're flossing those. And also the ones that are a little bit darker, we're going to have to put a filling in there to arrest that decay. Or maybe you're talking about the light pink ones with remineralizing. The easiest workflow to remember is you've taken the x-rays, you turn them off, all of the AI, turn it back on, you decide very quickly, and you move to your treatment plan. If there was some way I could find in my day to decrease time I spend on a regular task, I would do that. And that's also what Pearl is focusing on here, is making that radiograph review be so much easier for the dentist and so much more informative to make those decisions. Calculus bone level measurements, you're going to see those as well. CEJ to bone crest, completely customizable. An interesting thing we found when we started having teams tell us this was, Sheela, we've been submitting some of our images in addition to our regular documentation with our claims, right? With those attachments. And they're seeing a lot less scaling and root planning denials. And that was a big game changer for Pearl. We were really surprised by that. We actually made a full printout. I'll share that with you in a moment. This is how patients are understanding how they're going to accept the dentistry earlier. So again, no change in workflow, right? We take our regular images with our regular imaging system and our standard I cannot speak tonight. Standard sensors. I'm so distracted by how cute this little guy is. So, and we review them, right? All the things we're already doing on a daily basis. And then where the magic happens is when we take our own image review from night to day, but also our case presentations. Imagine trying to explain to a patient, those of you that are clinicians here, on number 30, you may need a root canal, but we're going to watch the area of decay over here on this small lesion on 28 distal, and on the tooth on top of that big one that's concerning you, there's another small cavity there. And you see these little spurs of calculus, right? So for us as clinicians, we're reviewing radiographs faster. There's a lot of times, I remember when I was managing a practice where a patient would come in for a limited exam or a toothache or something. We take a Panorex and we have just as much going on the other side. Or we take a couple bite wings and we see, wow, we've got a toothache today, but we've got 3 or 4 coming down the road. So it's nice to have the AI act as that reminder. Take a closer look over here. I know the patient came in for number 30, but what's going on with number 3? And where are we at periodontally, right? So where we're focusing this evening is on engaging the patient, being able to make sure that they no longer have to look at black and white images, right? So we talked about the very best tool is using this chair side for the patient. The entire purpose tonight was, okay, how is AI going to help us enhance case presentation? Well, it's going to just colorize things to make that presentation so much more patient friendly. And if we can decrease that 64% of patients that don't understand x-rays or their consultations because we're using the x-rays, then we've done our job, right? We all went into dentistry to make an impact and take the very best care of our patients. And now we're going to have a tool that allows us to really do that. So you have these printouts as well, patient-friendly printouts, and we're able to think about how do we use this as a full team tool? So dentists are using this every day to infuse trust with the patients, whether it's a new patient or an existing patient, right? I remember as a hygienist, there were so many patients that when they came into the practice, we talked about, in the morning huddle, Sheela, you have 7 patients today, 3 of them have unscheduled dentistry. And I look back at my notes and I'm thinking, I told them they had cavities and I told them, they needed fillings before they got bigger. But really, is it a matter of them understanding or trusting? They'll never tell us, but there's a lot of data here showing that if we can use a more transparent form of explaining dentistry to a patient, then the case acceptance was definitely going to increase. Now, what about that hygiene doctor handoff, right? Like I was saying earlier, this is not a tool that just lives in the doctor's office and he or she will review it right before they go into an exam. This is a full team interactive tool where, again, no workflow change. You're just opening up second opinion, take a quick look, and you have all of these features at your fingertips. Hygienists spend a lot of time preparing for that ideal exam. In my last practice, we saw over 2,000 hygiene patients per month, and we had 7 doctors. It was a single owner practice. I'm sorry, 2 doctors own the practice. But what we found was we really had to make sure that the doctors and the hygienists were on the same page. And what that meant was we empowered the hygienist to also really be that co-diagnoser, right? what needs to be done, why does it need to be done, and where is the patient at, were the three things we wanted to make sure that the doctor was given that information of when they walked in the room. So, we can see here, Dr. Bob came in today, and we see that number 5 has an area of concern, a very large concern. That crown just fell off last month, and we wanted to talk to you about that. Also, we're going to do some scaling and root planning. There's some areas of calculus. So, and now the doctor is well informed, and the hygienist has spent a lot of time with that patient, right? We get to spend, I don't know, maybe sometimes 25 or 35 minutes with the patient. So empowering the hygiene team to have these images up and running is a great way for you as a team to be able to incorporate this in your daily workflow. Hopefully by now you're seeing how this is painting the picture of, wow, we just turn on a different screen and now we have images for the patient. I can also look at all these images as a clinician before I walk into that room. Dental assistants are always what I call the glue behind the practice, holding everything together, right? And I remember when I was a dental assistant, I was just thinking, wow, there is so much going on here. I need like 10 more of me to run around this office and make this happen. And the interesting part about dental assistants too is as the doctor walks out of the room after they've made these recommendations in the restorative operatories, the patients always turn to the assistant and say, "What? Do I need to do that?" Right? "Would you do that if it was your tooth?" Or "What exactly do I need to have done now?" Right? When I was working with associates and we talked a lot about um, exams, it was interesting to see the very last half of that case presentation. New clinicians would talk a lot about, okay, Bob, so you have, a two surface filling we need to do on the right side and a crown on the lower right side, and we probably need to do some crown lengthening. And they'd walk out, and at that time I was a treatment coordinator, and I said, okay, so do you see up here, we have a couple cavities. And down here, we're going to be doing a little bit of surgery to make sure we can put a crown on that tooth. Very simple, go through the whole spiel. And this is just because we needed to help the dentist, the younger ones at the time, explain things in a patient-friendly way, right? So those dental assistants and those treatment coordinators that are out there were key to really helping the patient understand what they needed when sometimes patients are fearful of asking the doctor to explain things again. So the admin teams, again, when you're presenting dentistry, a lot of times, the admin teams are just doctor runs up or the hygienist run, we need 4 quads and 3 fillings and they're coming up, right? And it's like, oh my goodness. So there's so much to do for that front office team member to be successful as well. Now we've given them an additional tool. So when we're presenting that 2-surf comp strange piece of paper that we give all of our patients on their way out when they don't schedule the dentistry, we now have a visual aid that we can use when we're presenting dentistry, right? So we've really kind of adopted this way where we show that x-ray on paper one more time, we just print it out and we say, okay, for Kimberly, I'm beating her up today. I know she doesn't have any cavities, but Kimberly, you have some cavities we talked about. You can see this big one on that lower right molar tooth. The doctor wants to start there before that decay goes into the nerve of the tooth. So we're going to start there and bring you back for some cleanings after we get through getting a new crown on that tooth. Do you have any questions? Excellent. After we looked at your insurance, it's going to be, $800. However, they're doing that is existing workflow is already occurring every single day. But it might just be that that last visual aid allows that patient to really ask those questions, understand the treatment a little bit more, and be able to move into accepting it. Now, are we expecting every patient to review radiographs and understand them and become radiologists? No. But if we can show them in a way, especially the last contact with the front desk coordinator, then great. Maybe they do schedule that treatment. And if not, you're going to email them, feel free to use these images. Like I was saying earlier, if nothing else, submit the scaling and root planing bone level measurements with your existing documentation to help decrease your denials. That's a huge win. So hopefully you can see tonight that when we focus on patient care and the patient's understanding areas of concern that we're recommending, By using radiographs, we take the very best care of the patients. They do accept dentistry earlier and more often. When we look at Pearl's average case acceptance being 30% in the first 30 days, it's because teams have adopted this existing workflow where they just turn on the tooth parts or have the images up and ready for the doctor. Now, I am going to open up for questions in a few minutes, but I want to kind of have you think about this for a minute. Second Opinion lives in a very easy website. Take the x-rays, open up Second Opinion. In fact, and most teams have a little desktop icon, and it clicks open and the patient's name is right there. And we have the x-rays ready to go, forward facing, hopefully on the monitor when those exams are, those doctors are coming to the exam. We have a very exciting, unique partnership we just announced with Carestream. And we showed you before all of our Second Opinion images and how helpful this is for teams. And it's a very simple workflow. But what we want to share with you tonight is taking that workflow and essentially eliminating that extra step of finding that website. Inside of Carestream Imaging, you will now see Pearl's Second Opinion native integration. You will be able to see this live in real time, and you simply click the images, an AI button, all of your detections appear, and you even have tooth parts. So this is very fascinating for teams because they don't have to remember a password or where was Second Opinion desktop again. In fact, you'll probably have to turn the AI off to see your radiographs if it's defaulted on. This is really the most fascinating side of removing any challenge to workflow change. So the fact that teams are putting Second Opinion directly into Carestream has been the big game changer. We talked about tooth parts. It's right here inside of Carestream. And what I want to share with you guys is that we've talked with a lot of offices during beta testing, and they're beta testing with a Second Opinion. And in the past, some integrations didn't build the whole set that Pearl had. They may have left out tooth parts. They may have left out, areas of segmentation or even hover. There's some features that weren't inside of an initial native integration. And I said, so what do you guys think about Second Opinion versus this native integration? I said, I know you don't have these robust features. Is that concerning? And they said, hands down, Sheela, I will take a native integration any day with less features over a basic Second Opinion. Now, I love Second Opinion, but it is true, right? I had 17 hygienists. Imagine trying to make sure the desktop button was always available for them. So having it natively integrated really helps that doctor, the hygienist, and the assistant in their daily workflow. Tonight, we do have a special offer, and I want to make sure your team is aware of this as we open up for questions, but you will be able to scan this QR code and try out Second Opinion for your first month for free. And again, in just a moment, I am going to bring up the CE QR code. But I want to stop here. I'm sure there have been some questions. So Kimberly, if you see that there have been some questions in the chat, we love to open those up. And John and I are here to answer any questions you may have.
So bear with me while I come online here with you. Um, a great question about just understanding the bone level measurements specifically and how those are, how you get them. How does that work specifically? And do you still need to perio probe?
Oh, wouldn't that be great if we didn't need to perio probe? That would save so much time. So we still need to perio probe. We cannot see where the gums are and the pockets are on the radiographs, unfortunately. But what most teams have been able to see is when we have a yellow line, which tells us that the bone level measurement from that CEJ to the bone crest is actually in an area of concern, it's going to turn yellow. That alerts your team to take a closer look, evaluate the existing probing depths, check that pocket, see if you need to move a patient to the next type of dentistry, or how are we doing? Is it bleeding? The yellow line is a reminder that there's warning to the patient and to the clinician so that we can always make sure that we're taking the best care of the patient. When you take the x-rays, um, obviously, the more accurate the radiograph, the more accurate the AI will be, right? Just like when we're trying to read them, people always ask me, does Pearl detect decay on overlap teeth, right? And I'm thinking, well, humans can't do that. But believe it or not, we're starting to see areas where the molars are overlapped and you'll see a little tiny pink dot. As a reminder, take a closer look because it's picking up those shades of gray. So I think we're going to see the AI really start moving into a more diagnostic place here in the near future. Bone level measurements are customizable, excellent for submitting claims, great for taking the best care of the patients and using for patient education.
Thank you so much. And then there's been a couple questions about what it works with. And obviously we're here with Carestream Dental and focusing on that integration. Thank you, John, for, for joining us. But there is questions about what sensors, what different models, and then kind of there's a one piggyback, but I'll let you guys handle that first one first.
Sure. So I'm happy to let you know that we integrate with a lot of different imaging systems, and having the native integration is by far going to be your easiest experience. But I think the best way to find out if it's going to work for you is to scan that QR code, do a demo with your whole team, and have them take a look at that full suite of Pearl Second Opinion, Practice Intelligence, and also for Carestream, if you have that imaging system, this is really kind of a simple one-click button and you're able to focus on, wow, I now have AI. I just need to make a quick phone call. There's a certain version, I think, maybe John can help us
Yeah,
out.
that's what I
Yeah,
was going
so
to hope for.
yeah, I can speak to the Carestream. So the Carestream, this is going to work with anyone on an RVG sensor, 5,000 or 6,000 series. So really everything that's come out in the last 6+ years. In order to use native integration, you will have to update the latest version of the CSI8 solution, which is included with the purchase of any piece of equipment. So you have it there. The update's pretty quick. It's very easy, but yeah, so it's going to sit just as a refresher. Any Carestream RVG sensor and CSI8 is the software.
Great.
Perfect. I have a feeling this is another answer that it is a big, it depends. Please contact us because there's so many variables. But there was a question about the subscription and pricing model and setup fees. And maybe that's regarding this offer for Carestream imaging that has to do with your first month free. And obviously we don't charge a setup fee for that. But Sheila, can you just, maybe I've already answered that. It's it's going to depend.
Yeah, I think so too. I think the best thing is to scan the QR code, take a quick demo. It's really probably 15 to 20 minutes. And with that first month free, we're able to honor that. So we can look at your historical and make those decisions. And, not described on this call is really our second and third different sets of tools that we have with Pearl. So you can also look at that, which would be more of the practice growth side of things where we're auditing all your charts and then ultimately insurance type verification tools. So tonight, what we want to do is give you that offer to be able to just try this out, right? And what we always ask is, okay, what did you think, doctor? And the second question is, what did your patients think, right? And I think an interesting statistic is that 87% of patients prefer to go to the dentist with the latest technology. That was a very high statistic. When I was reading through that literature, I thought, wow, I was even kind of fearful of AI when I first started. I'm like, what is it going to do? And as I've seen it really in action, there was one study that I was working on with the clinical team, and I actually had tears in my eyes, guys, because I was watching disease progression over time. And you would see like this little area of recurrent decay. And we can look in the practice management system and say, like, was it treatment planned? And it wasn't. And then it got into a larger area of decay. And then that patient came back a year later and the tooth was completely broken off, right? So I say tears because I'm thinking, wow, that patient could have got something done much earlier and it's probably so expensive and the patient could lose their tooth. Now that's the extreme, But at the same time, what happens with scaling and root planing as it progresses, or what happens with these incipient lesions? If we're having a tool to help make better decisions, then we're taking the very best care of our patients.
Thank you, Sheila. Do you want to tease any future use? There's a question about CBCT.
Oh, yes.
How much do you want to tease?
Okay, I just for this special group, I am going to share. Hold on, let me grab it. Some new fun stuff. But the important part is to think about right now when we're using AI, can it buy back some time for us, right? That's a huge win. But when we think about where is it going, I talked earlier about imagine the ability to have an image and you think about how many months is it going to be before it passes into the dentin, right? Are we able to surface that? And same thing with scaling and root planing. Let me grab that slide for you. So Pearl is currently working on some CBCT stuff, and we're focusing on predictive analytics as well as thinking about taking notes for you, right? That would be a really great thing. So I remember when I went to the doctor last week and the doctor came in, and this was a regular doctor, and he came in and he's holding his laptop like right in front of his face. Hi, Sheila, how are you? How have you been? Tell me how you're doing. And I'm thinking, wow, patient care has really left the building in this situation. And imagine if they could just come in and start talking and it would record everything, right? You wouldn't have to stay till 6 o'clock at night doing all of your charting. And so that is kind of the goal, is how do we solve those pain points? Okay, I found my CBCT slide. Those pain points that really throughout the day, when we know the staffing shortages that we currently are dealing with in dentistry aren't going away anytime soon. Can we find ways to use AI to automate mundane tasks so we can spend more time with our patients? So we will be focusing on this in the future, and really kind of highlighting ways to be able to show anatomical segmentation, thinking about treatment planning, as well as like that Pt.2 area where we never know, is that going to exist in that tooth, and how do we find that extra canal and fractures and such. So that's going to be a very exciting suite that we move into. This is not out yet. Everybody asked me, can I get that tool? And this is what we talked about earlier, which those predictive analytics, right? And moving into, wow, imagine being able to show this to a patient, right? For their gums or their teeth and their bone when we're talking about the need for scaling and root planing. And ultimately, again, our teams are trying to focus on those pain points that you don't have to go in and chart every tooth, right? You hover over and you can make that decision. You don't have to go in and write it, I mean, not write it in the chart, but click on tooth number 4 with, 2 surfaces. So I think the future of dentistry is really going to be focused on how do we solve these pain points so that we can buy back time with our patients.
Is this all cloud-based? Do I need to upgrade my Office server? And I think you could take that both ways. Let's talk about the native integration inside Carestream Dental Imaging, but then also the individual as well. So that's kind of a two-parter question.
Yeah, I can again answer that. No, you wouldn't need to upgrade your server. This is all cloud-based. What happens is with the latest version of the software, it just creates kind of a contact point, for lack of a better phrase, with the Pearl AI software. So you won't have to make a significant upgrade, just upgrade your software.
Excellent.
Also, there's a question in the Q&A from Stephen Miller about Logicon. I do want to address. So
Perfect,
Logicon
thanks.
is only interproximal. So the reason we went with partnership with Pearl, Logicon still exists, obviously, because it's there. But the reason we went with Pearl is because Logicon only could detect interproximal cavities and caries, and Pearl is obviously much more robust than that. So we partnered with Pearl just honestly just for next steps. So to answer the question, hopefully that answers it.
Yep, excellent to have those periapical radiolucencies, those notable margins, right? Extra bone level measurements, to be able to, again, act as those reminders while reviewing radiographs.
Perfect. Because it's cloud space, obviously there's a ton of concerns about patients protecting patients' information. Can you speak to our patients' x-rays being stored somewhere? What sort of cybersecurity is in place for this? John and Sheila, I'm sure, can answer.
Sheila, go ahead. You know the Pearl system better. I can explain the Carestream piece, but the Pearl piece is the more critical one here.
Yeah, I think the rigorous amounts of compliance regulations, FDA standards, and protection policies we have to uphold are unbelievable. So there is not a concern. We don't have to, you guys don't have to worry about that as far as a compliance side of things. If you have additional questions, we have information on the website. We also have a full compliance team that'd be happy to reach out to any of you, but we are in over 120 different countries in the world. So we have a lot of patents, a lot of clearances. We'd be happy to answer any questions or concerns you may have.
I think and I'll answer the question there is the x-rays are not stored within Pearl. So the x-rays would, if you're using for example, the native integration, everything is stored within your CSI-8 software. The images themselves are all that's being transmitted. There's no patient data attached to them in any way, shape, or form. This is standard practice on our part. They're scrubbed. So Pearl does get obviously the x-ray itself, but with no patient identification information whatsoever. Hopefully that answers your question.
That's awesome. And then, yeah, are they stored or something like ASW? But you answered that perfect, John. So as I was rereading the questions, the answer came in. Thank you. That's what the answer they were looking for. Oh, one last question's coming in. Everyone, drum roll, please. Okay, there's a particular office that their imaging and software is office-based server, so it's cloud-based.
I can answer this. I think when we're using the word cloud-based, I think it's creating some confusion. So when we say cloud,
got it, thanks.
For the native integration, there's a cloud interaction. Nothing is cloud-based. So we're taking the scans from your site are being transmitted. The data is being transmitted up to Pearl and then transmitted back. There's no storage that's being done in that process. It's still stored locally within your device. So if you have it's not going to significantly increase. Like all of a sudden your x-rays are going to quadruple in size. So there will be no significant impact to that whatsoever. And to your question about maximum storage, there is no storage. So it's whatever your PC can hold. We build them. They've usually got more than enough space to store all of this on there. So
I will tell you a kind of an interesting success story. We had a larger DSO in Florida, and they had some storms and a bunch of internet issues, and some stuff went down, and they were calling us saying, wow, we're still able to see patients because we could pull up images in Pearl, right? So that was a big win for them. And they were able to review radiographs and still move through those patients that had, major emergency appointments during that time. So that's another added bonus for your teams.
There's a question that just came in the chat of what does Pearl offer over the competition besides our integration with CS?
You have myself and Kimberly. That's all you need. So I think it's a good question because, there's a lot of AI companies out there. And the interesting thing back in the day when I started with Pearl, it was clinicians saying, why do I need AI? Or do I need AI? Or I don't need AI. And we've moved into which AI company am I going to use time? So it's a great question. For Pearl, our focus has been aligning with the clinicians. And what we mean by that is we're built by clinicians for clinicians. Not only are we making our interface very simple and intuitive, but when you look at our more robust suite, you're going to find that you have an entire calendar that's organized based on opportunities for the doctors. These are going to be printed out in a patient-friendly format. So no longer having to audit charts. And again, like I was saying, the full suite is allowing the entire patient experience to end how we always want. A patient understands the dentistry. They accept it because they were given the quote in the office. And we're seeing with the x-rays, plus our daily printouts, alerting teams of unscheduled or AI detections, and the insurance verification. That full suite is focused around optimizing the patient experience in a very simple way. And I think that's what separates our company from our competitors, because we're not giving you codes to research, and we're also making sure that this is in a workflow, an easy workflow oriented layout, so that you don't have to change anything in your day. I also like our notable margins, because those, like I was telling you earlier, are really helpful for teams to be able to take a closer look at. And so I would say you have to make your decision, but we have found that our interface and our ability to solve those pain points has really been the differentiator.
Awesome. Thank you, Sheila. And then John, just some clarity here. They're using CS imaging. Great choice. 8.0.24. Does it have to be upgraded? And I think I
It
know the
does.
answer, but I'll let you do
Yeah, it
it.
does. So this version is going to be 8.0.28. It is releasing in the next couple of weeks. It's coming out as part of this. This big announcement is going to be next week in Chicago midwinter. So I was going to say anyone at the Chicago meeting who wants to see more about this can come by either the Carestream booth or the Pearl booth. Both obviously will have this. We'll both be showing Pearl off there. But once you want to get the latest version, you will need to update 8028. We can easily assist you with that. From 2.4 to 2.8 is very easy. I mean, I actually went from 2.6 to 2.8 earlier this week. And then the last one I see is from Dr. Kwiecen. No, you don't have to be part of DSO. Pearl is available to anyone and everyone. So all you have to do is be a dentist. It's kind of it.
Perfect. Sheila, there's a question here, a question / comment, statement saying, sounds like it's a lot to learn. Can you speak to the onboarding and how teams have come to integrate this into their practice, and really, like, is there a learning curve? What does it look like? What does onboarding Pearl look like?
Yeah, that's a great question. And I think that's always the biggest fear, right? Is how are we going to really bring this up in our workflow? What do I have to learn? There's a lot of colors. And I'd like you guys to know that we do one-on-one team trainings. We also do our webinars that are CE certified. So you have a lot of access. We also provide like provider-specific videos. So I'm a hygienist. How do I do this? I am a doctor. Why do I need this? Or what do I need to push? When you look at your basic home screen and you're looking at your FMX like you do now, you're just going to see some dots that say, hey, there's some areas of concern here. There's like four or five colors. And these dots remind you to take that closer look. You're inside of the interface. And whether you're in Pearl or a native integration like Carestream, the only thing you do is turn this off to view your x-rays, turn it back on, and use tooth parts, right? To be able to share this with your patient. So there's really no big change in the workflow. I think the biggest thing is, where is it on the desktop, or where's the AI button? But you have a nice legend in both of our systems to be able to remind you what calculus is green. And most teams, by the second patient they've used it on, completely understand how to do it. And in fact, a lot of teams just go straight into it by watching our video. Very intuitive tool. Excellent question.
Perfect. So can you just, I know you referred this earlier, the little green boxes that are near the CEJ, maybe if we clear off the rest of the detections, it'll make that really clear. But yeah, you just hovered over it, the calculus.
Yeah, calculus is there. My favorite, makes me want to get my scalar out. And then also, we didn't really kind of highlight the situation where, we go through and we talk about running so fast in dentistry, right? And this patient comes in and maybe they're diagnosed for a crown, and did we see that periapical radiolucency, right? I hold my space bar down just like this. And are we thankful that that was pointed out to us? So I think that raising that clinical excellence, focusing on those basic pathologies that we're all looking at every day, and bringing your life from black and white to color. Imagine back in the day where we used to watch black and white TV. Probably a lot of you didn't do that. I remember doing that. I actually had to get up and change the channel too, heaven forbid. So I do think that we as clinicians benefit from this, but when we talk to our patients, asymptomatic lesions like calculus or periapical radiolucencies, we're really kind of allowing them to kind of be their own co-pilot in the diagnosis, right? And like I was saying earlier, is you spend a lot less time showing shades of gray when you can bring it into a patient-friendly colored version. And that's really the magic of AI with case presentation.
Perfect. I love that. You know, if they can read Google Maps, they can read tooth parts. Um, a question about identifying implant systems. Is that on the roadmap? Can that be done? You know, where everyone's used to holding their implants up to the what implant is this? I used to work in the implant land, so I've
Yes.
gotten pretty good at it. It's my secret superpower. But talk to me about AI and implant identification.
I think you should hire Kimberly for some consulting. She can help you figure out and give you a flow chart on which implant it is. I remember in dentistry too, it's like Bob's here in room 4. He wants to do whatever. What kind of, you want to do the crown? What do we have the tools? Call the periodontist, right? Maybe they can swing it over at 2 o'clock. And it's really unfortunate that we haven't solved that problem. So I know there's a company in Europe that has you're not in Europe, I know, but that has somewhat solved that problem. I think that is on the roadmap at some point. Not right now in the near future. We're trying to bring the kind of the most widely used diagnostic tools to the market, like CBCTs and that kind of thing. But it is a wonderful ask. It is a huge pain point, and I'm sure it will become standard of care for AI companies to say, hey, this is Nobel or this is, I don't want to mention names, but whoever else it may be. But great question.
Perfect. Thank you so much. But I
Sure.
think that's the end of them.
Okay. Well,
We're
that
so
may,
grateful everyone stayed with us.
yes, I know. I like to make sure at the end that I don't have like, start at 100 and there's like 3 left. That's always a good sign. But again, all 3 of us would love to talk to any of you. So please feel free to reach out. If you have any additional questions, looks like it's a free trial. So there's no reason to not try it. And again, we look forward to seeing you on some sort of training in the future. Thanks, everybody. Have a wonderful evening, and we hope to see you soon.